Uh, Thank you, Steve, and welcome back, everybody. This session is, we've got it scheduled for an hour. We have three speakers. This is client case management in the time of COVID-19. I'll just read a quick summary of this. The COVID-19 pandemic has had a compounding impact on tribal communities, resulting in increasing rates of physical and mental illness, high unemployment, homelessness, the loss of loved ones, and extreme financial insecurity. So this session will explore approaches that TANF and new caseworkers can take in responding effectively to the holistic needs and challenges faced by their clients. So we'll talk about strategies, engaging clients, and focus on the mental and emotional well-being of clients and staff as well, I should say. So we have three speakers in this session. We don't have a Q&A, a formal Q&A embedded into this session, but if you have questions, you can type it into the chat box, either to me or to everybody. And if we have time on the end, we can address. If we don't have time, we'll try to do a follow-up on these questions at some point. And you can also use the ofa@blhtech.com email as well. All right, so we have the three speakers. We have Geni Cowan, who is from Eagle Blue Associates. Geni, Choctaw African American, is a professor of educational leadership at Sacramento State University and has worked with tribes and county and state human services organizations on tribal TANF programming and case management for 25 plus years. Dr. Cowan has a doctorate in education and a master's in counseling psychology. Her experience and expertise is in leadership development, assessment, coaching, diversity, and program evaluation. Mary Aguirre-Mendoza is the TANF Executive Director of Soboba Tribal TANF program. Dr. Maria Aguirre-Mendoza is a member of the Gabrielino Tongva tribe, hopefully I'm saying that right, of Los Angeles, California, and she serves as the executive director for a Soboba band of Luiseno Indians. While in this position, she's helped serve hundreds of American Indian families in both rural and urban settings. She obtained her bachelor's degree from the University of California at Berkeley and went on to earn her master's and doctorate degrees from California Baptist University in Riverside, California. Over the past 10 months, she's worked with her team at Soboba Tribal TANF to ensure mental health counseling in the COVID-19 era has been a priority in their case management approach. The unique needs of individuals and families has come to the forefront during these times of crisis. Yes, indeed. And our third speaker is Carey Reyes, who's the program manager at the Colville Tribal TANF program. Carey Reyes has worked with the Colville Tribal TANF program since 2004 in various positions and has been the program manager since 2008. Carey has lived on the Colville Indian Reservation her whole life and knows the area of service, members, and challenges very well. Okay, at this point, I am going to turn it over to Geni Cowan.
Thank you, Sam. Hi, everybody. Good to kind of see you. Not necessarily hear you, but good to be in the presence of family and friends again. It's been a long time since we've been able to gather, and we still aren't gathering the way we'd like to. This set of circumstances we're in has uncovered or created some different problems than maybe what some tribes may be used to in working with your clients. So we're going to give you not necessarily all the answers because I don't think there's time for that, and because new problems will continue to emerge as a result of all of this. But there's some things that we've learned and we've noticed along the way that we can talk about and hopefully be of some assistance in giving you some input, some direction, maybe some ideas about strategies you can use to support your clients. Steve, are we gonna start with the PowerPoint now? That would be a good Good place to begin. Maybe we are. Maybe we're not. Well, while that is happening, I want to start, and this first part of our discussion this morning is going to be focused on identifying some of the issues that have been created or been facilitated by the pandemic. Some things were already there. You know, people's personalities generate a lot of their responses to circumstances in their lives, and that's true for all of us. It's human. No, Steve, I'm not seeing any slide at all. Maybe if I do this. Yeah, there we go. Some of the things that we see on a normal basis when things are regular. We see people behaving and reacting with stress. We see fear and anxiety in our clients and in our coworkers. We see anger. Grief and loss is very common, just as part of the human condition. Being hopeless and feeling helpless are also, I mean, these are just human responses, emotional responses to life in general. Under pandemic conditions, these get amplified, and they can be so strong and appear so overwhelming that they are immobilizing. So this is where clients, coworkers, friends, family members, this is where we really need each other. In order for your clients to restabilize, in other words, to get their feet under them while we're going through this, these are issues that have to be directly addressed. Now, of course, in most programs, if not all tribal TANF programs, case managers are not mental health professionals. So we have to start there. We start with the fact that you are not trained, nor are you certified to treat these conditions. At the same time, these are human conditions and they're going to come up anyway. So one of the questions you have to address is, when do we refer? When do you refer out? Another question you have to address is, in an emergency, when somebody's experiencing these things and has hit the wall, so to speak, what do we do? How do we help them? You're not providing treatment, but you are expected, particularly in case management, to respond with some kind of input or strategy that will restabilize the client until you can address the issues. Next slide, Steve. Thank you. Talk about stress first. Stress is one thing. We all experience it because we all work hard, and just life in general comes with enough conditions for us to feel stressed, but those are amplified during something like a pandemic. Part of the reason is a feeling of loss of control. You worry about whether or not you're going to be able to stay healthy. Some people worry about, when is it coming to get me? Have that kind of a mind frame around the pandemic. Other people fall into major depressive episodes at the feeling of loss of control. You no longer are in control of your life or your health. You start to play the role of a victim. Some of the symptoms you see of it are listed here. These are symptoms of stress, no matter what's going on. If you recognize or observe those are things to pay attention to. And that's really what the point of this is. How do you know if someone you love and care about, or a coworker or a friend or a client, is having an amplified experience of stress? How do you know? What do you see? What are the symptoms, so to speak, of when someone's in distress and needs assistance? Next slide. Now, here's the unique part of this pandemic. Under normal conditions, of course, we all have certain experiences. And then when you have a pandemic, we all have an additional set, if you will, of experiences with the stresses brought on by it. But the instruction or the remedy, if you will, for chronic infection in this case is staying away from other people. That's difficult to swallow because we weren't built for that. Humans are not made to be separate from each other. But under these conditions, that's the best medical advice we have: social distancing. For some people, it's very awkward to do that. I find myself, there was a guy out cutting my trees yesterday afternoon, and I don't know who he was, never seen him before, but I thought I'd go out and find out why he was cutting my trees. And I forgot to take a mask. It never occurred to me to stay 6 feet away from him until I was out there, and I thought, wait a minute, I'm supposed to, I have to back off. It was a very awkward moment because under other circumstances, I would not have backed up so far. Under other circumstances, it would have been a casual encounter. Under a pandemic, there's nothing casual about it. Some people are getting very paranoid about being around other people. Some people are just downright afraid to be around other people. When you're quarantined, you're supposed to stay at home. There's this thing called cabin fever. We've been experiencing it now for 9 months, and many people in our population are over it and can't tolerate it anymore. Again, we weren't cut out for this. Next slide. You're going to see an increase in the problems that go along with just being human in this society that we already deal with. We already deal with issues of substance abuse and physical and emotional abuse and so on and so forth. These are going to get exacerbated because of pandemic conditions. Next. So the whole point of this part of our discussion is to talk about what you might expect to see or to hear or to notice with your clients or with people in your world who are experiencing some distress. I see it all the time. I had a class last night and one of my students just broke down and she had to stop. We had to stop everything. She was so angry. She's so unbelievably angry and nowhere to direct her anger. She was frustrated because she didn't have a target and she didn't know why she had to stay home when other people are not staying home. Well, other people are defying the order to stay home. She could, and I told her, you can defy it too if you want to. She said what her frustration was having no choices, no reasonable alternatives. How do you not stay at home without taking a risk? You don't. Under these conditions, we just have to get real with the way things are. They are not the way we want them to be. They are not the way we're used to them being, and they never will be again. So that's another piece of the puzzle that we have to address in case management. We have to recognize it's not only true for us, but it's deeply true for our clients. The upside is our clients have the experience of instability. They have the experience of an unknown future. They live some of these realities on a daily basis. So from their histories, they may not struggle as much as people who are used to stability and who are used to knowing where the next meal is coming from and having a roof over their heads and so on and so forth. That can be, to be unstable in a time like this, when you're used to living like that, can be really frustrating. But when that's normal for you, this doesn't seem so out of normal. What we do face, if that's our experience though, is health issues, life and death kinds of health issues. We're facing a disease that kills. The difficulty there as case management staff is you have to educate your clients and then you have to teach them responsibility. They have to be able to say, I'm putting a mask on, I'm staying away from people because I'm taking care of myself and my family. I'm protecting them from what might kill them. I'm protecting myself. I need to be here for my family needs me. Whatever the truth is for your client, your task is to amplify that. They need to be constantly reminded it's compounded responsibility having to take care of all of this and still try to find work and income and so on. But that's part of the responsibility. That's the complexity of responsibility that comes along with a pandemic. You might see people feeling kind of desperate and afraid that the resources that they are used to being able to rely on might not any longer be available or might be more difficult to get to. That's okay. That's probably going to be true in some cases. So they're not being paranoid. That actually is happening. As case management staff, our task is to teach clients skills that will allow them to manage the difficulties that they're facing as a result of the pandemic. And we're going to talk a little bit about what other programs are doing to address issues like this. And then we're going to circle back and talk about strategies that you can actually implement if you're not already. I'm sure many of you are, that will support your clients and strengthen what you offer or how you approach the case management task. Talk to your clients, listen to how they are living with this. How are they managing? How are they surviving? What do they fear? Don't be afraid to ask people questions that you might otherwise think might send them over the edge. It's too late. They're already over the edge. Most of us are. After all of these months of being locked down, if you will, and of struggling with an unseen enemy, it is not at all unusual for anybody. It doesn't matter whether you're case management staff or client, you're human. So what we're talking about are very, very human responses to very difficult circumstances. I'm gonna back out at this point and turn my time over to my colleagues.
Greetings, everyone, and thank you to ACF staff and OFA staff for inviting me to share a little bit about our program. This presentation will provide an example of how we incorporate mental health services into our case management processes. Soboba TANF has been providing mental health counseling services through a holistic approach from even before my time. I started with the program in 2008, and these services were already established at that time. So we've kept them ongoing over the years, and we've seen the positive effects that it has on clients' lives. Counseling gives participants a better understanding of mental health, and it helps break down stereotypes. A lot of times, clients are ashamed to be, referred over to the mental health counselor, but when they see that, it'll have a positive effect on them, they're a lot more willing. So it provides the program the ability to help clients find their ideal self-sufficiency plan by helping them break down barriers. Steve, if you could change the slide, please. So as part of our case management process, we have two assessment processes. The first is the mental health counseling, which is the mental health counseling appointment that we refer our clients over to through our in-house therapist. She'll see them on site at our TANF offices, at their home, or even in her practitioner's office. And then right now, we've had to kind of change things up a bit with the pandemic, and she's offering telehealth appointments. And then the other assessment that's part of our case management process is our vocational career assessment. which kind of takes care of the whole career side, assessing academics, educational skill levels, occupation, helps detect disabilities and other barriers to employment. So if we could change this slide. So the benefit to clients from our counseling services is in a multitude of ways. It helps them meet program requirements, provides a better understanding of what counseling is, and helps open up the conversation about other resources in the community. The clients usually realize they speak to their workers about what issues they're facing. If they speak to their workers about the issues that they're facing, they're going to get more help from referrals and other outside agencies and resources that they may have not been previously aware of. So it opens up the dialogue for our program staff to be able to share with them other resources in the community. And then families have increased privacy as the counselor will cater to the family's needs, whether that means having an office, telehealth, or home appointment with her. And then the therapist also offers emergency appointments and makes herself available based on the severity of the situation. So we have a really great staff here at Soboba TANF, and at any time they can contact our therapist and let her know if there's an issue going on or an immediate need. And then counseling is offered through individual, family, and or group settings. And our practitioner also offers classes to our participants, whether it be parenting, family bonding workshops, or in group settings. So it helps familiarize them with her. So if we can change the slide. So counseling Counseling is provided through or through different approaches. Our practitioner actually provides equine and animal assist therapy. This has been found to be especially useful for children and individuals dealing with trauma and special needs. She also offers eye movement desensitization and reprocessing therapy, also known as EMDR, which is found to be particularly useful for those dealing with trauma. And then play therapy, which has been found to be helpful for children and adolescents. And then art therapy, which works for those who find it difficult to talk about the issues that they're facing. So it's really a wake-up call for our clients. It aids in their personal growth and development. It promotes family formation and unity when offered in the group settings, and it also helps build positive self-esteem, family relationships, and taking care of one's mental health. So it really brings awareness to our clients of the importance of their mental health to their self-sufficiency path. So if we could change the slide. So from a program standpoint, we contract with our therapist, and we offer these services through our program for all of our sites. We're currently, we have 4 offices. We have one in the city of Riverside, one at the Soboba Reservation, Santa Rosa Reservation, and Kauai reservations. And so our therapist works with families at all of our sites and makes the services available. It also helps build trust between program staff and clients, and it allows us to continue with the holistic approach, and it helps to bridge the gap between a participant's mental health and their self-sufficiency pathway, and identify all the barriers that they may be facing. So a lot of times clients will come and sit in front of us and they may not let us know the full extent of what they're going through. But once they talk to our therapist at least once, she'll give them advice and kind of guide them on different things that they could talk to us about and get help with. And so it really kind of opens that door and it helps us build that trust. You could go ahead and next slide. So if there's any questions, I did include my contact information. I'd be happy to share with anyone if they have other additional questions or thinking about ways of incorporating mental health services into their program.
Maria, there was a question that came in via the chat while you were speaking. I believe that was for you. Yeah, 1122. Yeah. Deanne asked, do you use a specific career and vocational assessment, and what's the cost associated with it?
I don't have the exact cost available with me right now, but if they get in contact with me, I can share that information. We do our career counselor does the COPS assessment, so it's pretty much the interest inventory, and then they also do an educational assessment to see where their skill levels are at in all the basic areas, so math, reading, writing, and even computer skills, to see if they need to, you know, brush up on those skills while they're with our program, so that they can do be more successful with their job search.
Okay, yeah, go
Our
ahead.
staff, our caseworkers will put the counseling session on their work plan, so they'll actually get an hour, you know, for seeing the therapist, and then from there, the therapist will let us know, well, you know, or they'll let the client know, actually, you need to be seen like once a month, or, you know, twice a month, and we'll give them work hours for it to incentivize them going and continuing with that help.
Okay, we got another question, which is kind of related to what you were just talking about, but this is, can you give an example of how these services are built into the family self-sufficiency plan?
Oh, for instance, if somebody's going through a DV crisis, or, you know, something of that nature, we'll make sure that they get referred out to like the Family Justice Center, which is the organization in our area, and make sure that they're getting plugged into those services. And so pretty much what we're ensuring is wraparound services. Or if they're having issues like maybe a child is having developmental issues at school, our therapist will intervene and get in contact with the school district and request like an IEP be done with that child, you know, to recognize whatever issue is going on there. And then in other ways, they can also probably, well, they have detected in the past disabilities with adults, and making sure that they get referred over to the Department of Rehabilitation or other programs that may be able to help them, maybe at the local community college, if it's on their work plan that they're trying to do a certain vocational or educational program, they can get plugged into, you know, special services there.
Great. Okay. Are there any other questions for Maria before we move on to Carey Reyes? Okay.
Okay, sounds great.
Thank you, Maria. All right.
You're welcome.
It's all you, Carey.
Okay, so I was asked to provide kind of information on how we were doing our case management with the COVID. And at first we weren't quite sure how we were going to run it, because when we shut down here with the tribe, everybody was shut down. I mean, there was nobody working. We were given admin leave for several weeks. And then when we were able to come back, it was, okay, you can come back part-time. Only so many people can be in the office. And then we were having issues with, okay, well, we still need to provide services. So how are we going to do that? Well, provide laptops, you know, they can work from home. And so at that time, everybody was buying laptops. You couldn't find laptops anywhere, you know, because not only was, you know, programs trying to buy laptops, but individuals, families was trying to buy laptops because of homeschooling. So we ended up getting a hold of Eagleson, and we're currently renting, I want to say about 15 laptops from them. And so I have social workers coming in every other day. The other days that they're not here, they're working from home. And we were some of the ones that was actually buying out Walmart and you know, the local stores of laptops, because we were purchasing laptops for the school age kids so that they can do homeschooling. And so TANF children, we were buying one laptop for each household. Our support services haven't really changed. Of course, the public was not allowed in any of our buildings. So our clients have learned to get tech savvy. So they text, they email, we fax, or they go outside and they'll call us and they'll say, hey, I'm outside. I need to drop off an income for this month, or, I have a JOS, justification of service, or they'll ask for a gas voucher and we will, bring it outside for them. But our support services did slow down for a while because the vendors were shut down, because when the state of Washington first shut down, everything was shut down. And so our support services we were really doing a whole lot, maybe gas vouchers and stuff. And then as the state started kind of opening back up, we were getting the regular support services done, and we're still continuing to do the regular support services of, the gas vouchers, clothing, winter clothing, things like that. Our caseloads hasn't really gone up. We do have a few more child-only cases, and we did gain a couple because we ended up losing one of our TANF cases, regular cases, to the grandmother or mother passed away from COVID. And so the children went to, I believe, an uncle. And so we've had different things like that go on. Otherwise, we have our emergency operations center that helps with the, people that are in quarantine and things like that. But other than that, we haven't really changed much other than the hours. And we're able to forward our work phones to our personal cell phones or personal home phones, so that when they are working at home, they're still able to get phone calls from their clients without, having to give out their phone numbers. So I think that's mostly it.
Okay, Carey, there was a question that came in while you were talking. What about tablets? Can families utilize those for homeschooling and other activities?
We haven't really bought any tablets because we just bought the laptops. And we were actually going from Omak to Wenatchee to Chelan, clear to, I think, Spokane, Colville. I mean, we were buying out Walmart of what they had in their laptops. Yeah. And we were trying to stay away from tablets because you can just because, and the different things that you can do with the laptops. Seems like you can do more with the laptop than the tablet. I don't know.
Okay, yeah, it looks like we're getting comments. Some other folks have purchased Chromebooks or laptops for their students. And then somebody mentioned they gave out $250, I'm going to assume like a gift card for Walmart for COVID-19 supplies. Okay, are there any other questions for Carey before we're going to actually circle back, and Genie is going to finish out this session? But any other questions? Okay, not seeing anything. Thank you, Carey. We're going to turn it over to Genie again.
All righty then. Thank you, Carey and Maria. What you guys were talking about are the kinds of strategies that our clients, no question, need for not just for mental health support, but for survival, to sustain their efforts. We also have to address and we have to consider that in the midst of it, they're going to struggle. We're struggling. And if our struggles are any indication, then you can imagine what the experience is like for a client. So what do you do? What can you do? What is within your realm to do? What you cannot do is treat your clients. It's not your role, not your job, and certainly not what you were prepared to do. Always remember, and many of you who have been in my trainings, you've heard me say before that everybody's looking at you. Your clients take their cues from you. How should they respond to this? Well, they're kind of watching to see how you respond to it. If you fry yourself, meaning if you overdo it and you become overwhelmed, then they're going to note that. And there's probably nothing more frightening than relying on someone for assistance and finding out that they need as much help as you do. So I always, and you've heard me say this if you've been in any of my trainings, I believe in the flight attendant's creed. Put your air mask on yourself before you put it on the person next to you. Our ability to assist our clients starts with taking care of ourselves. So you got to pay attention. What's your experience? What's happening to you through this? How are you managing the frustration? How are you managing to stay at home? I was fine until about a month ago. And then I realized I was bouncing off the walls. There's only so much I can do in this house. I've practically rebuilt it. There's nothing really left for me to do. And I got to come up with something or I'm going to go, maybe I'll just tear it down and start over and rebuild it again. Whatever your strategy, recognize and acknowledge that this is unusual. This is not what you normally do or how you normally live, but you're not in normal circumstances. So you have to pay attention to the extraordinary. If you are, well, okay, I talk to my dogs a lot. Why do I talk to my dogs a lot? Because everybody else is tired of hearing me. I gotta talk. That's human too. That's the need. Our need to interact it's normal, it's natural, it's built in, if you will. Even if it means you're talking to a dog, and thank God for dogs. You have to pay attention to the fact that this set of circumstances is cutting us off from each other. We don't live very well. We don't survive very well without each other. So we got to reach out. We got to pay attention. We got to take advantage of what's available to us. And in my case, there are 3 dogs running around this house who just love the living pieces out of hearing me talk. Thank God. If you missed it, you should try to find it and listen to it again. Dr. Oz, bless that man, did a show on sleep. I didn't realize, but I now understand how important sleep is to our health and well-being. And it's not just about your physical health. It really does have a lot to do with how you think, how clearly you think. It has a lot to do with emotional and mental health. Make sure you're getting good sleep, not just, napping and dozing and catching a few hours here and there, but you really need to get solid, sound sleep. This is so important to your ability to do the work that you do. If you have to, think of it in terms of what your clients deserve. What do they deserve from your program? They deserve the best assistance that's available, and that is in your hands. Make sure you're eating right, exercise. That's one of the things that I've heard from people living through this is they call it the COVID-15. Well, we already know what that means. Enough said. You gotta move. You can't let this pandemic. You can't let these conditions of quarantine and so on. Sometimes it's not the disease that's going to kill you. It's all of the things you have to do to keep from getting the disease. You know, if you don't exercise, if you let yourself go, so to speak, you're damaging your own health. Stay in touch with people. Even if my sister lives in the same city, but we communicate by Zoom because she and her husband on the other side of the city, they don't want to take a chance. And I can't say that I blame them. So we still stay in touch. My mom has learned to Zoom at 88 years old. I'm still amazed. She now knows how to Zoom. She doesn't know how to do anything else. I get all kinds of emails, but she can Zoom because she wants to talk to her kids. Acknowledge the fact that this is a tough set of circumstances. Acknowledge the fact that you too are human and you get frustrated, you get overwhelmed, you get scared. It's natural. It's who we are. It's what we are. And the remedy for that is each other. If you have to, just reach out to a coworker who's also homebound. I do that often. Some of you know Dr. Chavez, and you've been in our trainings. He and I, at least once a week, we're Zooming. And because we're both stuck at home. California just got another set of stay-at-home orders that our region fell under last night. So we're staying at home again. And we're both very frustrated, but we've got each other. You can use this time to exercise your creative chops, hobbies, things that you've done in the past, things that you've wanted to try and haven't had a chance to. Here's a good time. You might not ever have an opportunity like this again. One of the innovative, if you will, or initiative kinds of activities that we can be known for is making the best out of the worst. You know that thing about making lemonade out of lemons? Well, we got some lemons. This could be the time when you become a published author. Spend a lot of time writing. Why don't you publish it? I learned to do woodworking and I made things. And now my mother wants me to make her things. I can hardly wait for this to be over so I don't have to make more things. Next slide. This is what you do for your clients. Make sure that they understand that you understand. It's so important for them to get that they're not weird. This is not abnormal on their part. This is just about recognizing and acknowledging that we as a community are in a very, very, very difficult set of circumstances. They're not crazy. None of us are crazy. We are experiencing something that is going to take some work to manage. So you are the broker, if you will. You're the middle person. You're the one they connect with to connect elsewhere. Be the person they reach out to for support. And support is sometimes as simple as listening. Suggest things like, oh, I don't know, why don't you build something? Why don't you draw a picture? Why don't you go for a walk? Like Julie was talking about, nature walks. Things that people don't generally think of to do, we have this incredible opportunity to actually do for ourselves. Some of us don't think of it in the moment. Well, this can be your role. You can offer those as suggestions, as input, as recommendations for how they can improve their experience. You can't relieve them of this experience. None of us can. But we can sure give you some ideas about how to make it better for yourself. Next slide. What do you do for each other? Oftentimes when we're talking about dealing with stress and managing issues and so on, we talk about first serving, or well, taking care of ourselves so that we can Second, serve our clients. But it's not common that we talk about our team. You know, for in each tribal TANF program, there's a team, there's a case management team. Y'all work together to serve your clients. How do you take care of each other in the process? Remember that we are all sharing a common experience with this pandemic. So we really do have lots that we can talk about with regard to the daily experiences. I used to, many years ago, many years ago, people said that when you get old people don't talk to young people because young people can't understand the experience. So old people talk to each other because they understand each other. Well, now that I'm old, I get it. Now it makes sense. So when I want to talk to my younger brother about my aches and pains, he just kind of looks at me like, well, take an Advil. But when I talk to my partner about my aches and pains, she goes, yeah, me too. It makes a difference. The ability to empathize is based in part on experience. We've all felt what we are feeling now, under different circumstances, certainly, but we've all felt it. Maybe never as strongly or as overwhelmingly as we are now, but we've been there. We've been lonely. We've been miserable. We've been scared. We've been angry. We've had all of these emotions. We've already experienced them. So it's a good reminder for each other. We've done this before. We managed it. We made it. We beat it. We got over it. Give each other that validation. Give each other that leg up. You have a common experience. You work in the same environment, so you understand the same things. You can use shorthand when you talk, but you really do need each other for that validation. Your team has to stay strong through all of this, and the ability to do so lies in each person on the team. It's how you guys take care of each other. It's how you hold each other up. It's how you are there for each other. It's how you model for each other. And how you do that together is a model for your clients and their families. Next slide. I think. Boy, that's slow. Last thing I want to leave you with is this. Anybody who remembers George Harrison remembers the album, All Things Must Pass. It's true. Nothing stays the same. Existence is about change. Things change all the time. We don't always acknowledge it. We don't always recognize it, but life is in motion. So we kind of got to roll with that. Understand and recognize that in this moment, it feels like it's always going to be this way, but it won't be. We will pass this obstacle. We will turn a corner. How we turn that corner depends on how people get together, if you will, around the public health orders, around what they're being instructed to do to take care of themselves. If communities get on board with that instead of resisting it, we will turn this corner much more quickly. And maybe we'll learn enough so that we don't have to do it again. In doing so, please recognize that things are never going to be the way they were. That's good, and that's frustrating. The frustrating part of it is that's what we're used to. And for so many, we want to be able to go back to what we know. That's very, very human, so there's nothing wrong with that. The flip side of that, and the side that needs our attention, is that we have learned some things from this that will make us better, that will improve our journey, that will make us more effective at the work that we do. So we kind of have to, at some point, we have to stop, look back, and think about, okay, so what did we do differently? How did that work? Is this something we should continue to do? Or is this one of those things that we need to go back to the way it used to be. That's a conversation that your program must have at some point. And I would recommend sooner rather than later. Look at this time as a chance to change. Maybe it's forced change because none of us certainly asked for this, but the reality is this is where we are. This is the world we live in. What can we use it for? How can we grow from this? How can we change our mindset? How can we be better than we were? Think about for yourself how you want things to be different for you. What do you want for your life, for your profession? How do you want to be better? What is your new normal? Everybody's going to have one. So what's yours? This is an opportunity to control, if you will, what the pandemic is leaving us with. Pandemic, we have no control. But its impact, its results, we do. In doing so, you teach your clients to take some control of their own circumstances. And that's one of the strategies that is necessary to help your clients be not just successful at getting work, but maintaining their success. They got to learn to control and manage their circumstances. And this is a great opportunity. It's a great chance for you to model that for them. So that's it. That's what I came to bring today, because we had such a limited time. But I hope and pray for everybody out there, and I do mean out there because you're all over the country. Use this time to benefit yourselves, and thus benefit your clients, and thus benefit your communities. Yeah.
Great, thanks, Geni. That was awesome. Just looking at the comments too, you got a lot of words of affirmation and agreement. Self-care is so important. We dealing with the clients, we recognize that they're facing extreme challenges in these times, but we also are as well. And I totally agree about that COVID-19, the 15. I'm struggling with that because I'm at home now, so I can cook bacon more often. You can't eat bacon every morning for breakfast though. So, and now that I'm not commuting, I don't get my walks, my daily walk, because when I would commute, I would actually walk up a hill, and I'd walk about a mile a day. So I have to consciously think about that and make sure that I get out and walk in my neighborhood. So yeah, great points. I'm gonna just yeah. So I just got a reminder to fill out the survey that's going to appear on the screen. If there's any other questions, go ahead and type it into the chat, either to me or to everybody. We're going to be coming up on a break at noon, which I believe is for 15-minute break starting at noon. Okay, I'm not seeing anything popping up as far as questions or anything. So I wanted to thank our speakers again. That was a really good session. I thought it went very well, and we are doing good on time. We're actually a little early. So because we're coming up onto a break, I think it would probably be okay if just reconvene here at noon. I don't have any other announcements, and the poll should be popping up for you. All right, thanks everybody.